My name is Dr. Ivy Haskins. I was born and raised in a small town in Michigan called Lambertville, which is on the Michigan-Ohio border. I received my undergraduate degree in biology and political science from the University of Michigan in Ann Arbor, Michigan, and my medical degree from the George Washington University in Washington, D.C. I was fortunate enough to be able to stay at the George Washington University for my general surgery residency. I also completed a research fellowship at the Cleveland Clinic in abdominal core health and a clinical fellowship in advanced laparoscopy, specifically bariatric and foregut surgery at the University of North Carolina in Chapel Hill. So why did I choose to become a doctor? So I knew at a very young age that I wanted to help people and that I wanted to make a positive impact on people's lives. And while the definition of those actions and the ability to achieve those goals may mean something different for every person, for me, I felt like the medical profession and becoming a physician would allow me to best achieve those goals. For me specifically, I do bariatric foregut and hernia surgery, and the impact that those operations has on a patient post-operatively and their quality of life is quite dramatic, and that's very rewarding and fulfilling. And for me, it just kind of reinforces my decision to choose that specific surgical subspecialty. So when I sit down with a patient for the first time, I actually try to get to know them personally before I talk to them specifically about the reason why they're in my office. I feel like a lot of patients have anxiety when they're visiting with a physician, and specifically when they're seeing a surgeon, I think that anxiety is even more significant. And so I really like to be able to connect with the patient on a more personal level so that they recognize that I can treat them and see them as a person before their pathology. From an academic standpoint, I have access to the latest technology to help my patients, and also am challenged every day to keep up with the most recent clinical practice guidelines for the specific diseases and pathologies that I treat. And I'm also an educator, and I have the privilege of not only giving back to the medical students and the residents and the fellows on my service, but also to any of the care providers that either directly or indirectly take care of my patients. As a tertiary referral hospital, I'm able to see a wide spectrum of patients, from the most straightforward to the most complicated, and even patients who may need revisional operations. And the collegiality that I've experienced here, not only amongst my partners and within my department, but across departments, has really allowed me to take a more personalized approach to each patient, and still understanding that we're all working towards one common goal, which is sound patient outcomes.